The father of a young boy with a rare mutation of cystic fibrosis is relieved and excited that Pharmac looks set to finally fund a drug that could mean his son's life is decades longer than predicted. Pharmac announced it's reached a provisional agreement with the supplier of Kalydeco, and pending further consultation, the drug could be available as early as March. That's after years of petitioning from some families. The government's drug buying agency declined the initial application back in 2014 due to limited evidence of its benefits for the rare disorder that damages the lungs and digestive system. One of the people who fought for Kalydeco to be funded is Eddie Porter, whose 2.5-year-old son Otis has cystic fibrosis. Eddie says the news today is exciting first and foremost for his son, who might just get a new chance at life.
There's also just such excitement for all the other families in New Zealand that have this same condition. So there's young children, there's brothers, sisters, mothers and fathers with this condition, and to each of them it's just such a huge opportunity. And the same thing, it's a renewed chance at life, and it's a changed life, one much for the better, and that's really exciting. And I guess the final part of that is there's hope there that this is medicine for a rare disorder, really. So G551D cystic fibrosis is technically a rare disorder. Its incidence rate is 1 in 156,000, and Kalydeco being funded is a great source of hope that other medicines for rare disorders might be funded too, that other families can share in the excitement that we're feeling right now.
So what difference do you think this drug will make to your son who has cystic fibrosis?
So the clinical data for this drug is really sound and robust, and we know that if he can get on Kalydeco early enough, so my son's 2.5 years old, if he is on this early enough, he is much less likely to get sick, and the illness is he'll be able to get rid of a lot more easily, and those illnesses typically manifest in the lungs. So people with CF are more prone to lung infections. Those lung infections can set in, are really difficult to shake, and ultimately cause lung damage and loss of lung function. So if Otis is on Kalydeco, a lot of that damage is nipped in the bud, so it can't happen in the first place. So for Otis, it's going to mean a lot less pain, a lot less suffering, a lot less time away from school and friends and all of those sort of things through illness. It's also going to mean improved lung function. So although he's still quite young, the chances are there's already a build-up of the secretions in his lungs, which can cause a degradation in lung function. It's going to nip that in the bud as well. And
so a longer life expectancy, Eddie?
Yes, absolutely. So the life expectancy as it stands in New Zealand for someone with CF is 37 years. And well, the sky's the limit for people on Kalydeco. Probably decades added to that if he can have access to Kalydeco early enough.
How long have you been waiting for this?
We've been waiting about 2.5 years. So Otis is 2.5 years, and he was diagnosed shortly after birth. So as soon as we found out his particular gene type, and we learned more about Kalydeco and that he would benefit greatly from it, we've been trying to get Kalydeco for him. We've been trying to get the best treatment we can for him. So,
but it was out of your reach. Waiting. It was out of your reach financially without funding from Pharmac.
Yeah, absolutely. The list price, so the price that Joe Public would pay if they were to go and buy Kalydeco, is $360,000 a year, and that's just so far beyond the bounds of anything we could reasonably think to afford on a personal level that it was just not possible.
So the Health Minister has said today that this provisional agreement to fund this drug demonstrates the strength of the Pharmac model in delivering effective new medicines for New Zealanders. Do you buy that?
Tricky one to answer. I think it demonstrates that the Pharmac model can work, but I think it also demonstrates that this is probably no coincidence that Pharmac has received a boost in funding this year. I think of 60 million, and over and above it was budgeted, which allows Pharmac to then move through its medicines awaiting funding. So I don't think, I think there's still work to be done. I think we've still got the opportunity to fund more of these medicines, and I think that means looking at the operation of Pharmac, how it works, and going, okay, well, how did we get to this point? How can we replicate that? How can we keep doing that? And that is really, it boils down to more funding, the ability for Pharmac to move sequentially through its list, or be able to buy more medicines and have greater means to do so. And I think there's very much still work to be done there. I think it's a great day for CF and for rare disorders in general, and medicines for rare disorders, but I definitely think there's more that could be done.
And do you think your campaigning and agitating has helped reach this point?
I hope so, and I hope so in fairness to everyone that has helped and has made noise and has supported the campaign and has gone out of their way to support what's a relatively small patient group. I think any time that a group of people are vocal in what they're trying to do and what they're trying to achieve, and they have a compelling case behind that, I think that does have effect. I think it's only natural that it does. And yeah, I think the hard work of a great number of people have helped get this across the line, yeah.
So realistically, when do you think Otis will have access to this drug?
In reading the release this morning, it looks like, provided everything goes through the consultation period, and it is an important point that there is still another step to go in this process, but all going to plan, the medicine would be available for patients from the 1st of March.
And that's Eddie Porter.